Hello. Thank you for listening in on this little presentation today. This is going to be pretty quick and fairly informal, but this is regarding sports concussion management, specifically in the junior high, high school levels. The reason I'm doing this presentation is really twofold. I wanted to give you guys some information on what the laws about concussion management say, some of the new things that we've learned about concussions, and then what our policy says moving forward. Really, just so that anybody who comes to Lago after me, hopefully there's not as much confusion regarding what needs to be done for concussion management. So some things I want you guys to hopefully get out of this presentation are to learn what the state laws regarding sports concussion are, to have a better understanding of what the current research into concussions is saying and some of the interesting things that we found through research, and then summarize the concussion policy here at Lago Vista ISD. To start off, let's talk about the law. So prior to 2011, there really wasn't anything in the books for management of concussions. But in September 2011, Texas passed House Bill 2038, Tasha's law, which gave some rules on how concussions had to be managed in the organized sports realm. It relates to all organized, sanctioned, or sponsored sports. This includes things like public schools, charter schools, anybody ran by the UIL. There are some exceptions to this, particularly with some private schools, but generally this law is pretty all-encompassing. I'm going to go through a few of the bullets. The first thing is that any athlete who has a suspected concussion by an athletic trainer, by a coach, a physician, or the legal parent or guardian, they must be removed from play immediately, right? So the law is really clear on that. If you even suspect a concussion, they do need to be removed from play. Once they're removed from play, then they can be evaluated further by a licensed healthcare professional, aka that's usually going to be your athletic trainer. If after that second evaluation it's determined that the athlete does have a concussion, there are some things that need to be performed, and they need to be performed in this order, and the law is very specific about these things. First, that athlete has to be removed from all participation. It means they can't practice, they can't play, they can't do any of that. Does not matter if they come in the next day and they feel perfectly fine. If they were removed, on a Thursday for a suspected concussion, even if they say they feel fine by Friday morning, if that concussion was confirmed in the evaluation the day before, they cannot return to play. Once they've been declared to have a concussion, they must be declared symptom-free and must be cleared to start a return to play by a licensed physician. After they've been cleared by a physician and they've been symptom-free, then they must complete a district return to play. And this is where a lot of people have some issues because they don't necessarily notice that, hey, they think once I have physician clearance, I can go right back to play, and that's really not the case. So any athlete that gets cleared by a physician still has to complete a return to play. It is against Texas law to return to play without doing a protocol, even after they've been declared to not have a concussion by a physician. These return to play protocols need to be evidence-based. We'll talk more on that in a bit. At a minimum, they have to meet the requirements of the UIL return to play policies, but districts can make their own policies more restrictive if a district chooses so, but they must meet at least the minimum requirements. In addition, the law also says that each school district has to have a concussion oversight team. Administrators, coaches cannot be on this team, but it's usually consistent of at least the athletic trainer and one physician. Although you can have more providers on there, it needs to have at least one of those. Coaches have to complete a UIL approved continuing education unit. I think all of you guys should know that by now, but that was a part of this House bill as well. And then that parents and athletes must sign a UIL concussion acknowledgement form prior to participation. And we include that in our pre-participation packets as well. So that's some of the laws regarding concussion, right? Not doing these things can get you in some serious trouble. So it's important to know. And while generally most of you guys have probably heard these things before, in the grand scheme of things, it is fairly new, right? I mean, these laws came out in 2011, so we haven't been practicing under these except for the last 9 years or so. So if you're somebody who's been coaching for 20, 30 years, large majority of your practice was before there were these laws managing it. And that's why it's really important to know what the current laws say about concussion management. So let's dive a little deeper into a concussion. What is a concussion? The medical definition of a concussion is that it applies from forces applied either directly or indirectly to the skull that result in the rapid acceleration and deacceleration of the brain. The sudden change in cerebral velocity elicits neuronal shearing, which produces changes in ionic balance and metabolism. Simply put, a concussion happens whenever the brain twists, shakes, slams, shears inside of the skull. You can think of it like the yolk inside of an egg. If you shake that egg, the yolk twists, it turns, and it slaps. Now, it's not so much that it only happens when the brain makes contact with the skull, but even a twisting of the brain can cause the different folds and parts of the brain to shear and rub against each other, which can still create these issues, right? It's not a structural injury, which means you're not going to be able to diagnose a concussion with an MRI or anything like that. You could look at an MRI of a concussed athlete and it'll come back completely normal. And that's because these injuries occur at a cellular or metabolic level, right? They're not really something that you're going to see at a larger structural level where you're going to see damage. But that doesn't mean that they're not a serious injury. This also means that concussions can happen even without a direct blow to the head. So we've often thought that, well, he didn't hit him with his head, or he didn't get hit in the head, he just fell on the ground. Anything that is either a direct blow to the head or an indirect blow to the body, if it causes enough shift and movement of the brain inside the skull, it can still lead to a concussion. So signs and symptoms of a concussion, we most likely know most of these, but to just kind of go through them quickly, there's a bunch, right? And you can look on there anything from headache, which is usually your most common, to things that might not be as common, like unexplained mood changes or dramatic mood changes. Someone gets really happy, really sad, really angry, and it's out of their normal behavior. We can see issues with difficulty concentrating, pupil reactions, balance, right? And that's because everything's controlled by the brain. So an injury to the brain can have really a large array of signs or symptoms. With that being said, it's important to know that a lot of these by themselves does not necessarily mean they have a concussion, right? So every single kid that comes to you that has a headache does not mean that every single headache is a concussion, right? So that's where a lot of experience and that clinical evaluation comes in as well, so that you can actually look at the symptoms that are presenting, relate them. Did the kid get hit? Did this just happen? Were they feeling fine? Now they've got hit. Now they have these symptoms. Or, did they just wake up with a headache? Because those are two very different mechanisms there. So important to note that none of these by themselves necessarily means that someone does have a concussion, but these are going to be signs and symptoms that might at least elicit further evaluation. In general, we know concussions are pretty serious. Usually they're not going to be life-threatening. That does not mean that they can't be, though. Especially when you return an athlete too soon, or they've had a high number of concussions, this is going to increase that athlete's risk of things like permanent brain damage, disability, or even death, right? And there's been lots of cases where an athlete had a concussion, returned back too soon, or didn't report the concussion, received a second concussion, and those can turn into life-threatening situations really quickly. Here are some red flags just for you guys to know in case you see something that might be out of the ordinary for what is considered a quote-unquote normal concussion, right? So if you notice their situation's getting worse, you see someone, you've pulled them, you say they may have a concussion, but you've been watching them, their symptoms are getting worse confusion, increasingly irritable, they're starting to lose consciousness, their headache is getting worse and worse and worse, or they have some of these other intense things such as seizures, repeated vomiting, etc. If you see that their condition is chronically getting worse, that's a good indicator that there's a bleed within the brain. So we want to make sure that we know these red flags so that we can call EMS or any kind of immediate medical attention if needed. With that being said, we've learned a lot of things about concussions, even in the last years. From when House Bill 2038 was passed in 2011, our understanding of concussions has grown dramatically. So here's a list of just some different things that we have learned throughout the years. We know returning to play too soon before an athlete has recovered can result in post-concussion syndrome, second impact syndrome that I talked on a second ago, some of this long-term effects that we're seeing with retired NFL players, such as CTE, other disabling or even fatal complications, right? We've seen higher rates of suicide in those with repeated concussions. We've seen higher rates of substance abuse in those with repeated concussions. And so it's really important to have a healthy and evidence-based return to play protocol in place so that we're not putting these athletes at those risk of complications. In general, it's been found in literature that the younger the athlete, the longer the recovery. A 18, 19, 20-year-old who sustains a concussion may recover in a day or two, or at least their symptoms may recover in a day or two, especially if they've never had a concussion before. A junior high athlete may not have symptoms resolved for a week or even 2 weeks. That's not uncommon. Generally, the younger the athlete, the longer the recovery is going to take. With that being said, it's also the number of concussions. So a junior in high school who has had 3 concussions in the past 3 or 4 years may have a longer and more difficult recovery than a athlete who has never had a concussion before. We also know that drugs and alcohol can both increase the risk of concussion and can decrease the recovery from concussion as well. So we want to make sure, like we always do, that our athletes know the dangers of drugs and alcohol. And one of those dangers is the impact and the negative impacts it has on sports concussions. We also know that helmets and mouthpieces are really good for preventing traumatic injuries, such as a broken skull, lost teeth. But it's important to know, no matter what kind of marketing you may see, there's no solid evidence so far to show any helmets or mouthpieces actually prevent concussions, right? So I know that's a lot of helmet manufacturers go to marketing, but and it doesn't mean that their helmets aren't good quality, but it's very, very difficult for a helmet or mouthpiece to have an actual effect on preventing concussion. We know that better prevention is going to be improved tackling techniques, improved practices, and limiting the amount of direct head-to-head contact that we experience with our athletes, especially in contact sports like football. We also know that ibuprofen and other anti-inflammatory drugs like aspirin or Aleve, these can really increase the risk of serious complications, especially if there's an underlying brain bleed. All of these are going to thin the blood, which means it can make it a lot worse. So if a athlete does have a concussion, we can recommend giving some Tylenol or acetaminophen, but you need to avoid any anti-inflammatory drugs like ibuprofen, Advil, etc. This is a old kind of, I guess, wise tale. This is something a lot of people thought we need to do. We need to, if an athlete has a concussion, put them in a dark closet with no lights, wake them up every couple of hours and make sure that they haven't slipped into a coma. The evidence shows these are things that we don't need to do. The best thing for an athlete to get over a concussion is rest. So we need to let them sleep. They need to be able to eat and they need to be able to rest. With that being said, the more we're finding that if you completely deplete their sensory, so you put the athlete in the dark closet and they're not allowed to see light or a TV screen or hear noise or anything, that you may actually be prolonging the recovery, right? So general rule of thumb here is don't do anything that causes symptoms to come back or get worse. So if watching TV gives them a headache, don't do it. But if sitting and watching TV doesn't give them a headache or doesn't increase their symptoms, then it might be okay with some moderation. So generally, someone with a concussion is going to want to sleep all the time anyways, so let them sleep. Just know we want to give them rest from anything that aggravates their symptoms. Student athletes need to be able to complete a full day of school before they do any physical activity, right? You need to be able to return to learn before you return to physical activity. And athletes and parents of athletes with any kind of history of repeated concussions need to speak with a physician about the long-term side effects. So if you have an athlete who's considering coming back to a sport that's had a history of multiple concussions, especially multiple concussions within a fairly short time, it's really important to understand the long-term side effects that repeated concussions can have before returning to that contact sport. Right. Again, there's not a specific law or rule on the amount of concussions you can have before you can't play. But there is a ton of evidence that shows those that have had repeated concussions are going to be at much higher risk of having more and at higher risk of having long-term side effects. These could be anything from depression, anxiety, suicidal thoughts, difficulty learning or concentrating, or any other kind of issues as well. And then there's a recommended return to play. We touched on that a little bit more, but to dive into a little more detail, it includes no activity is kind of the first stage. This is the recommendations by the NATA in their position statement on concussions. And you can see the return to play progression there from no activity through light activity, sport-specific, non-contact activity, unrestricted training, which would be like a full contact practice, and then finally a full return to play. And that each of these steps needs to be separated by 24 hours. So no more of we'll do step 1 in the morning and step 2 in the afternoon. We've really cut back on that, and we've seen that we need at least a day in between each step to properly go through this. So lastly, I just wanted to touch on our concussion policy. Athletes with a suspected concussion will be set out for evaluation by the athletic trainer, right? And this is going to be at both the high school and junior high levels. So if you see it, one of your athletes, and you say that they may have a concussion, right? The law is really clear on this, and so it's our policy. You need to set them out. If that's an away game, then you set them out for that away game, and the away athletic trainer can look at them. Or I can look at them when they get back. If it's a home game, you're trying to find the athletic trainer and get them evaluated. If that athlete's been evaluated then and is determined to have a probable concussion, they're going to be removed from all participation. And I say probable because it's better to err on the side of caution, right? So if I'm looking at it and I say, I don't know, maybe 60% chance they have a concussion, 40% they don't, we always want to err on the side of caution, and we're going to go ahead and put them on the protocol for that. So they'll be removed from all participation. Parents and the athlete are going to be educated on the policies, procedures, red flags to look out for, and then when they need to go see a physician. They'll see a physician once a physician signs off for them to be cleared and return to play. Again, this does not mean that they can go back to the sport. All right. So if a kid left, was diagnosed with a concussion, comes back and brings you a piece of paper from the doctor saying, hey, I've been cleared, I can play again, they still are not allowed to return until they complete a return to play protocol with the athletic trainer. They'll start that return to play protocol as soon as they don't have symptoms anymore. They've been able to go 24 hours with no symptoms, and they can start doing that protocol with the athletic trainer. Once they've gone through all the steps and they've completed it, then the athlete's parents and the athletic trainer will meet. They'll complete the UIL return to play form, and then the athlete is able to return to sport. And there really are no ways around this, both within our policy and within state law as well. Any athlete with a suspected concussion must be cleared by a physician and then complete a return to play program. And here is a picture of the Lago Vista ISD return to play. Just to kind of walk you through this, no activity, complete rest. If they're able to go 24 hours with no symptoms, they pass that step one. Then they're going to do a light aerobic exercise. It could be walking, riding a bike. It's going to be about 15 to 20 minutes max total, no resistance training. That means no weightlifting. If they're able to do this and doing this activity does not increase their symptoms, then they go on to the next step. Step 3 is sport-specific exercise. Oftentimes this may be doing some resistance training, lifting weights, stuff like that for about 25 to 30 minutes. Again, symptom-free. 24 hours later, they go to the next step, which is non-contact training drills. Essentially, any practice that's not going to involve them coming into contact with somebody else or some other object. And then they'll get to full participation, where they're going to go through a full practice, right? This could be a padded practice or a practice that involves contact or live scrimmaging. And if they're able to go through that and really exert themselves and still have no symptoms, then they complete the form and they've returned to play at that point. If at any one of these stages, so say we're on step 3, they're lifting weights, they get about 10 minutes in, they start to get a headache or some of their symptoms pop up, right? They do not pass that stage. It does not mean they have to go all the way back to step 1. It just means we'll shut them down for that day. And then 24 hours later, if they're feeling good by that time again, we'll repeat that step, right? And we'll just continue to repeat the step until the athlete completes it. So thank you for participating in this review of concussion management laws, some kind of new knowledge and information about concussions and the policies. I really hope that this was informative for you guys, and I want to thank you a ton for listening through it and working with it with me. There's a survey that I sent out with the email regarding this video. It would mean a ton to me if you could go on, complete the survey. There'll be a few questions, kind of just testing your knowledge on the stuff that we talked about, and then some surveys about what you thought of the presentation. So again, you can find the link in that email, and it would mean a ton to me if you guys could do that for me. So again, I hope this was educational. I hope you learned something from it, or at least it was a refresher for you going into the new year, and have a great summer.